Do you believe like a testosterone pellet or the testosterone shots help during a period like this?
It can help for some people, but not everyone. And what's
Mm.
interesting is we don't see specific correlations with low testosterone and low libido in everyone. When we look at the actual
Oh,
studies, at low testosterone, there are some people that have a fine libido and they we check their testosterone and it's almost undetectable. And then we have other people, like the opposite is true. So there are people for whom testosterone, if it is low, if they have low libido, you can replace it and get it back to a physiologic level, whether it's pellets or a topical. There is no FDA approved testosterone for women, by the way, so you can write to your senators about that because that's bullshit. And
mm.
so it's only approved for men.
What
FDA.
but is that because they haven't come up with it yet? Or like what's the problem?
The problem is that in order to bring a product through the FDA,
Mhm.
it has to have financial backing to do the studies.
Oh,
And there is not enough money or interest to do that for a testosterone for women.
interesting.
And
Okay.
so that is part of the problem. It's not that it's but so what we do now is we use pellets that are made for men and that frequently will give women far too much testosterone. We use compounded testosterone from compounding pharmacies who work very well, hard to get women the drugs that they need, but are not recommended actually by the North American Menopause Society or American College of Obstetrics and Gynecology or International Society for Women's Sexual Health, which are the ones who look at this. They don't recommend compounds because they are very inconsistent
Mm.
in their dosage. I absolutely prescribe compounded medicines for my patients, but I try to use the FDA approved medicines because they are consist they have to prove to the FDA dose to dose to dose that this is going to be the same for every woman. And
Right.
so you can use the FDA approved testosterone for men, but you use 1/10 of the dose that men use. And then
Wow.
we have to check the levels for testosterone much more than we do for estrogen or progesterone because if you over replace testosterone, you can get increased cholesterol, you can get liver problems, you can get hair in places you don't want it, and loss of hair in places you do want it. You
Right.
can get permanent voice changes, and you can get acne. Those are probably the big players. If your testosterone levels get too high.
Okay, so I know you do specialize in sexual medicine and knowing about all this. What would you say about that? What should people know that we don't know?
I would say that the number one thing that you can do, not just for your sex life, but for your long life in general, is vaginal estrogen. Absolutely, 100% vaginal estrogen. When we lose estrogen to the vagina, it used to be called senile vagina. But now and then it was called, vaginal atrophy, which was just slightly better, and now it's called genitourinary syndrome of menopause. And genitourinary and we say GSM because it's a whole
Mhm.
lot easier to say, but GSM is the changes in the tissue of the vagina, that you get with loss of estrogen and testosterone too, but primarily with estrogen. And when you get those changes, the tissue shrinks, it becomes less stretchy, it becomes more thin and can tear. I have patients who come in and say that it is like having sex with broken glass in their vagina.
So
And
obviously the symptom is it becomes very painful to have sex.
yes, but not only that, leaking urine, urinary urgency. Even if you are not having partnered sex with penetration, the changes to the urethra and the bladder that you get will eventually lead to recurrent UTIs. And I don't know if you've ever had close relationships with any older women, but when they get UTIs, they get mental dementia changes
Oh,
where that
wow.
puts them in the hospital. And urosepsis is when you get these older women get bladder infections that can kill them. They 20% of admissions to women in their 60s were to the hospital were for urinary tract related illness.
Wow. Okay, so how are you getting this medicine? Is this a shot? Is
So
it a pill?
it's so easy. You use there's multiple different forms of vaginal estrogen that you can do. You can do a vaginal estrogen cream just twice a week. Swab around the entrance of the vagina. There's a vaginal estrogen tablet called Vagifem that if you don't like creams and things, you can put that tablet in there and it dissolves over the course. And these are things you just do twice a week, and it protects you from recurrent UTIs, from painful sex, with recurrent problems with leaking urine, urinary urgency, all these things that are so preventable. And
Do you have to go to the doctor for this, or this is like at any CVS?
nope, you do have to they are prescriptions, but they don't have to be, they should be available from any primary care doctor, you just say, hey, I need vaginal estrogen. And the thing that is most surprising to most people is there is almost no contraindication. Right? People with breast cancer can take vaginal estrogen.
Mm.
People with former strokes can take vaginal estrogen. The amount of estrogen that is in a year's worth of vaginal estrogen is the same that's in 2 estrogen tablets
Oh,
that you'll
wow.
take for a
Okay.
whole year. And that protects the vagina.
Okay. Another misconception that people brought up to me is that people think that only your physical health matters. The impact on mental health and well-being really does require attention and care. People do get very depressed. Is
Yeah.
that what you found?
Oh, and not just me. The studies show it, bear it out. 35 to 40% increase in anxiety and depression in perimenopause. And
Wow.
and when we see that, very similar when we were talking about the PMDD, when
Mhm.
you have those estrogen levels drop, the serotonin levels in your brain uh, are affected.
Mm.
Serotonin and norepinephrine. And you can combat some of that with SSRIs and or SNRIs, which like things like Zoloft and Lexapro and Effexor. And that's what we did a lot of the time is we're like, oh, just put her on an SSRI. But we're neglecting all the changes in her brain that are happening, that we could prevent dementia. We could prevent the changes in the lungs, the inflammatory disease, all the problems in the joints, in the bones, all these things. Instead of ignoring what's going on in our brain and trying to just medicate that, we can try to balance that out and help some of that anxiety, help some of that depression.
Right. I think a lot of people also, the part of the depression comes from the fact that they think that menopause means loss of femininity, or it's like the end
Right.
of an era.
Yeah.
What else can people do to realize that is not what that means?
I think that the things that we're seeing here, that we see here with the change in Gen Xers and
Mhm.
millennials, it's a whole new ballgame, right? I
Yeah.
mean, it is a lot. It is a change, but it doesn't have to be painful. It doesn't
Right.
have to be that dramatic change, the dramatic loss of function, because that's
Mhm.
what we used to think this has meant decrepitude.
Right.
You became weak and frail, and that with now what we know about resistance exercise, getting a bone density early, don't wait till you're 60. You know what? Medicare wants you to wait till you're 65 to get a bone density. That horses have left the barn at that point. I
Right.
mean, there's no turning back. Go in and tell your doctor that I am 50 and I want a bone density now. And they can, if you can say, hey, I had a family history of osteoporosis, they should be able to get it approved. But even if they don't get a bone density, spend the $250 and find out where you are and combat those problems now. And this is what we're looking at, and what we thought of as Medicare of menopause is the lack of attention or care to maintaining our health.
Right.
It was allowing that decline to happen.
So, all right. So, just to recap, I
Mhm.
think it's important for people to really understand that this is not something that they need to fear. I mean, I think a lot of
Mhm.
it is that so many people don't want to talk about it. And then
Oh,
when you
yeah.
hear about it, when they do talk about it, there's so much negativity around it because everyone says, oh my God, it's been so painful. It's been so
Right.
miserable. It's affected my mental health. It's affected my marriage. It's affected the way I feel about my
Absolutely.
body. I wasn't able to fix the symptoms and it affected my lifestyle and all these things. And what you're saying is there are ways to remedy it, and there are ways to,
Mhm.
especially if you educate yourself on all the different things. But the first thing is to make sure that we know that you're in a stage of premenopause, perimenopause, so that you are, not overlooking some other disease because a lot of
Right.
these symptoms are things that could be multitude of other things.
Yes. Yes. And don't let yourself the people gaslight you into thinking, "Oh, this is normal. Oh, this is nothing. This is something you should ignore." And I
Right.
think that is the biggest thing. And if you can't find a doctor, if your doctor is not listening to you, then you need to move on. And there are a lot of good telehealth doctors that that are available to anyone in any state, if you can't find someone. But hopefully, you can find someone close by to work with, because
Right.
that is such an important relationship.
So, meaning that it is an important thing and it is a big deal that we're going to go through
Yeah.
something like this, or we are going through something. So, you should work with a doctor who sees the changes in you and is able to help you get through that and
Mm,
not diminish your feelings. Is that what you're saying?
absolutely.
Okay.
Or ignore them altogether, or send you to 8 different specialists that, um, not really finding the real problem.
Right. All right. Where could people find you, get a hold of you, or, if they want more information on menopause and what they're going through, where can they look that up?
So I am on Instagram, but I'm also at Dr. Kate White, OB-GYN. But I will say I always there are 3 books that I recommend to my patients, and I send them links, and mostly Audible links, because
Mhm.
it's a lot to get through.
Sure.
But so when you're driving somewhere, and those 3 books are The New Menopause by Dr. Mary Claire Haber, amazing, and gives you so much information on so many points, and nutrition and hormone therapy and all kinds of things that about what they experience and what you are experiencing, and is this normal or not. Then the other one is Estrogen Matters, which Estrogen Matters is a book by Dr. Avram Blooming, who's a oncologist, and really was one of the first books that went through, why do we feel this way? What are the studies show that makes us feel about, what are the good things about hormone therapy? What are the bad things? So
Mhm.
Estrogen Matters. And then the third one is The Menopause Brain by Dr. Lisa Mosconi, which is one of the most fascinating books about how hormones change and how it affects your brain, and what you can do lifestyle wise, diet wise, all those things to help preserve your brain beyond hormone therapy.
And you had mentioned before we were on air, but something about how you might be doing some in-person talks. Can you
Yes,
talk a little
yes.
bit about that really quick?
Yeah, so I'll be doing, and again, these are all in the works with some really amazing women that I are also in areas of diet, exercise, nutrition, um, breast cancer survivorship, sexual medicine. So we'll be doing some retreats coming up, but they'll be posted hopefully within the next 6 to 9 months, and bringing over one of Dr. Maggie Evans, and meeting up hopefully somewhat with one of the people I love. We talked about Kara Metz,
Mhm.
who does a menopause women's health exercise program. But lots of things out there to try to just spread as much information as we can, and try to get things online, but really to try to get things in person if we can, because there's nothing like being able to discuss your menopause story with someone who can really help you through it.
Right, and to really connect with somebody so you don't feel so in the dark
Yeah.
about all that stuff. Thank you so much for joining us today. I think that was really helpful. I think people should definitely feel free to reach out to you and
Yes,
look at
please
at
do.
all your stuff if they have more questions. Dr. White, I really appreciate your time.
Oh, this has been such a pleasure. And I'm so glad that you're helping to spread the word.
Yes, absolutely. Thank you. Thank you so much for listening to Misunderstood. I'm your host, Rachel Yucatel. Please be sure to subscribe to the show and give us a 5-star rating and review. You can support the show by joining our Patreon at patreon.com/misunderstood with Rachel Yucatel. Do you have ideas for the show or want to reach out? Email us at info misunderstoodpodcast@gmail.com. That's spelled MISS understood. Thank you so much, and I'll see you next time.